Welcome back to Healthcare Rounds. I'm John Marchica, CEO of Darwin Research Group. Today, I'm joined by Dr. John D'Angelo, who is the CEO or CEO-elect of Northwell Health. And as many of you know, we focus on healthcare business and policy topics here. And today, we're going to dive into leadership, strategy, and the future of healthcare delivery with someone who is really uniquely positioned to shape it. Dr. D'Angelo brings a unique perspective. Not only is he a physician, but now he's leading from the top seat as CEO. And we're going to talk about his journey, his vision for the organization, and where he sees healthcare in the years ahead. So, Dr. D'Angelo, first off, congratulations on the new role. And thanks so much for taking time. You've got some big shoes to fill.
Yeah, it's going to be a fun ride. Thank you for having me. Appreciate it.
So let's start with story. We don't need to go all the way back to medical school, but talk a little bit about what brought you here, and specifically as a physician. Now, being Northwell will be a physician-led organization. How do you think that might influence the way that you lead compared to the way things have been previously?
Sure. So I guess the short version of my background: I'm an emergency medicine physician. I've practiced now for close to 30 years. Did training in Geisinger Medical Center in Pennsylvania, worked in Massachusetts for several years, and then in 2000 came back to Long Island where I grew up. I was born in the city, lived in the city as a child, and then we moved out to Long Island, and I've been on the island for the most of my life. I joined Northwell in 2000 as a frontline ED doc at several of our hospitals, one on the South Shore of Long Island and one on the North Shore, so Glen Cove and South Shore University Hospital. And have always been someone that, although I wasn't looking for it, wound up taking on more and more leadership responsibility, whether it was in residency or so forth, just because of my passion to get involved and to learn. And I think that trait has been very valuable in my growth. Went on to be an ED director of one of our emergency departments, and then I'll give you the short version. Then went on to run all of emergency medicine for the health system. And in that role, several of our other verticals, our urgent care network, our EMS operations on the clinical side, established our central transfer center through a leadership team I've put together. And always very involved with emergency management and disaster preparedness. During the pandemic, I was responsible for the operations of the health system in our command structure. And then on the heels of the pandemic, I was asked to start up a new arm of the organization called Integrated Operations, which was how do we take everything we were able to do during the pandemic and really optimizing all of our assets and bring that into our day-to-day operations. And then simultaneously, shortly after that, I was asked to run our largest market. So for the last 4 years, I've been a market president running our Nassau and Queens markets, which is in and of itself a large health system within the health system. That's 24,000 employee, 6 hospital, 300 practice operation that I was responsible for the full portfolio, the full business, clinical, and operational kind of performance of.
So I was going to get into priorities, but I'm curious, what was one, say, major operational thing that you learned from COVID that you were able to bring forward operationally into Northwell?
Sure. One of the there are a lot of examples, but the one I'm most proud of, and I think really speaks to the value of systemness, is New York was in my opinion the epicenter of the pandemic in the States. And what people don't realize is all the numbers that you see of the prevalence of COVID during those early days, you have to multiply by 5 or 10 because for the first 3-4 weeks of the surge, there was no testing available. But to give you an example, Northwell went from an average of about 3,000 to 3,200 inpatients across our hospital inpatient beds during a busy flu season. That would be like our peak. To at our peak of COVID in a 4-week period, went from normal census to about 5,100 patients in our inpatient facilities. So, and it wasn't evenly distributed. So several of our hospitals, especially Forest Hills Hospital in Queens, which Queens, you have multi-generational housing. a lot of reliance on public transportation. Queens really was hit extremely hard early in the days of the pandemic. And Forest Hills Hospital, which is about on average a 200-bed hospital, an emergency department that sees, you know, maybe 80 to 100 patients a day. Now the ED seeing 300 patients a day. The hospital is, normally 14 ICU patients. We were up to patient 65, 66. We're sending resources in, sending vents in, trying to staff up. The place was being overrun. And as the head of operations, one Saturday night, we just said, let's start moving patients out. And through some regulatory waivers, made it easier to transfer patients. And we moved 6 ICU patients out that night. And the next day, we were like, that was more impactful than anything we can bring in. And subsequently, we moved about 400 patients between Forest Hills and one other hospital in a 4-week period out of those 2 hospitals, and really not only kept those hospitals running and better serve the community, but we leveraged capacity elsewhere in the system. And every single day, 10, 20, 30, our biggest day, 60 patients moving out of harder hit areas into other system hospitals. We called it load balancing, and again, moving. I think the number was 423 or 470 something patients in such a short period of time was a real demonstration of systemness. I think, and operational kind of savviness.
So if something, for whatever reason, if you were to get
Mm-hmm.
these kinds of peaks again through that load balancing process,
Yeah,
you'd be able to manage it.
we do it more today than we did. We did now with the and EMTALA has a real value. As you know, the EMTALA laws prevent hospitals from dumping patients, and we have to treat everybody as we should that shows up at our emergency departments and so forth. But there's a lot of various rules around transfers in the EMTALA laws. Those were all waived during the pandemic. So we do load balance. We continue to load balance going forward. It's just a lot more. It's not as broad in the volume. Um, but we now have in our playbook, if we know we're at a hospital that's at extreme capacity, we have conversations with patients very early in their admission saying, we can keep you here, but it's going to take X amount of hours or maybe even a day to find you a bed. And we have our Northwell hospital that's only 5 miles away where we can get you a bed right now. And we have the clinical teams are aligned and they're communicating if that's something you would be willing to do. So we have the conversation and offer it, but it's not to the extent of moving 60 patients a day like it was during the pandemic.
Sure, of course. So thinking about your first year, I'm sure you've thought a lot about this.
Yep.
What tops the list on your priorities? What are you going to tackle? What are you
Yeah.
focused most closely on?
So I think of this in two lanes, but I guess at first and foremost, protecting what makes Northwell, in my opinion, special, and it's our people, our culture, our commitment to our patients. So that's still going to be front and center. But if you ask me what I need to tackle, the things I need to be front of mind on are 3 main things come to mind. One is the transition itself, and it's not just the transition at the CEO level. We've had folks that have been with Michael since his start here 23 years ago when he became CEO. So we have other transitions of very senior executives which are on a similar timeline. So it's some would see that as a challenge. I see it as, even though there's incredible talent that's leaving, we have a deep bench, and it's an opportunity for me to establish my team and the operating model of that leadership team. So that's one thing I'm very focused on in the early days. Secondly, we just went into the largest merger of our history. So we just brought on the Nuvance health system as a full part of the system, which is 7 new hospitals in upstate New York and in Connecticut. Our first time running hospitals out of the state of New York. About 15,000 more employees in that merger, and that the success of that merger is critical. So another higher priority for me. And third is we've made the commitment a couple of years ago for a full digital transformation in the organization. So we're going to be starting as of this November 1st will be our first of 3 waves of an epic rollout. And we've been working very hard on really streamlining our data strategy and our CRM platform, our consumer relationship management platform. So the digital transformation is critical. And I'm kind of someone who's very in tune to technology, and I think it's a key piece of our future. So while we focus on the current game plan of digital transformation, I am also going to prioritize what is the where do we need to be as an organization and continue to innovate and think differently about how we leverage technology in the future. So rolling out Epic and a CRM and the data stuff, we need to do that. But what else do we need to be focused on? So what portion of our attention needs to be focused on innovation, transformation, and the delivery side?
Well, that's actually was my next question, and where you see the opportunities for real change, whether that's in partnerships, technology. But
Sure.
maybe say a little bit more about how you see. I mean, a lot of health systems are undergoing the same kind of
Yep.
transformation, moving from Cerner to Epic, Epic to Cerner,
Right.
whatever. You're coming from, is it Meditech or Allscripts? I can't.
Because Northwell's grown one hospital at a time, we have three. We have Meditech, Cerner, and Allscripts right now. We have several ADT systems, and we have some redundancies in various components of our technology stack. That's all now coming into one portfolio. So it's exciting for us.
So, greatest opportunities, do you think that lies in technology?
No, I think technology is a great enabler. I think there's a ton of great innovation happening both in medicine and research and in technology that we need to take advantage of. The thing I really want to focus the organization on, it's a little bit higher than that. It's how do, I think Northwell has an opportunity to really impact not just ourselves, but the industry. Um, I'm eager to get involved with solving for some of the future challenges we're going to have, and technology is a piece of that. But when I look at the several trends, so I think about the epidemic of chronic disease that we have in this country and all the drivers of chronic disease that we're seeing more and more of. I think about the aging population and the impact that's going to have on the delivery system over the next 10 years. And the capacity, if we continue to practice medicine the way we do today, will the system be able to meet the demand of that aging population? And the projected workforce shortages in general. And then as you think about the ratio of folks in the post-retirement age to the workforce, and how do we meet, I see these three things coming together as almost like a perfect storm that the industry has to get ahead of. In my mind, the way you manage that is you think differently about how we deliver care. So keeping the patient at the center, how do we really partner with patients and be much more proactive in care delivery? And not more episodic, reactive when diseases or things occur. So I think really, how do we forge partnership with patients, meet them where they're at, really focus as much on wellness and health along their journey, and be more proactive in maintaining health and preventing chronic disease, I think is critical. How do we better partner in communities? Because 80% of healthcare outcomes is not driven at the bedside and in hospitals. It's on social determinants of health, behaviors, lifestyle choices. So how do we continue? And Northwell's got a great head start on this, thinking about food and education and all the other drivers of health. So community partnership. And then I think as I think about the workforce, is people are worried about AI and technology replacing the workforce. There's not going to be enough workforce. So the question is, how do we amplify the capabilities of the healthcare workforce? Think about care models differently. How do we enable them with technology in that partnership with patients? And really just drive new care models going forward that I think AI and technology can be really meaningful if we leverage it the right way in doing so. And then thinking differently about how we meet that future demand. It's a real passion of mine that I think Northwell is uniquely kind of positioned to take a leadership role in.
So, Dr. D'Angelo, this question I'm sure is going to come out of left field, but I was thinking of it when you mentioned getting your start at Geisinger. This is just your opinion. I'm not asking for Northwell's opinion, but how important is it for you to have to own the payer component of all this too? And I know that they kind of dipped into that world for a while in a pretty big
Yep.
way, and then got out of it. But is that essential? Is it important, or is it not important?
No, I think it's important. I think we are, uh, when you look, there have been others that have struggled with. I think I've heard it referred to as payviders, and people have all these fancy terms for when providers are getting into the payment side of the equation. But we have now our Northwell Direct product that we do not only our own employees, our own 100,000 plus, but also do a lot more direct to employer and selling a Northwell product. I think it's an important piece of the equation. I think it's a way, and Geisinger has shown how you can help drive down costs, drive up better healthcare delivery. And it's, I think, not I think it's a mechanism and it's a tool that I think, if done right, could add value. So we're on that journey again, and I hope to continue that journey in a meaningful way. But I do think it's an opportunity for healthcare systems to take more control and also drive better health, as opposed to right now being paid predominantly for managing the end, the episodic kind of care as a result of not really driving real health.
Right, right. Well, certainly it looks like Kaiser's betting on it, right?
Yep.
um, so let's go back to AI just briefly, because there's so much
Sure.
hype. I mean, I feel like it seems like every week we're writing about some AI partnership or some AI development. But from your perspective, where are the real opportunities today?
Right.
And where are the things that health systems need to be careful about?
Yeah. I think in all AI and technology going forward, to the short answer, what we need to be careful about are the things people are concerned about. Do we put guardrails around these tools to be using them responsibly, to be protective of PHI, to be not relying overly on them blindly? It needs to be evidence-based clinical care delivery. You're still going to need the human aspect of delivery of healthcare. So we got to be conscious of all of that. That said, I think the power and where technology is going on the healthcare delivery side, I think of three lanes. First and foremost is, can it help us deliver better care more efficiently, more upstream, more proactive? And there's a lot of examples of that. Like, I, when I think about on the surveillance, monitoring, intervention piece, and I think about that aging population, how do we leverage home monitoring? How do we leverage even smart clothing to get further ahead of, like, someone's gait is off, or there's potentially a pressure ulcer starting before it's even visible? Like, I think about how technology can be really meaningful in identifying disease or changes in behavior or other things up more upstream. And we're seeing that early in the imaging, kind of technology that's coming out in AI and in those fields. So I think there's a real opportunity for AI to really amplify the clinical delivery, monitoring, intervention, earlier diagnostics that is has a lot of potential. I mentioned earlier, I think if we use it correctly, it can really, again, amplify the capabilities of the workforce, help meet workforce challenges of the future and today. And if you think about the workforce challenges today, you hear a lot about burnout. There's an epidemic of administrative burden that our frontline staff is plagued with. So if we can relieve that administrative burden and have our providers, our nurses, our doctors spend more time at the bedside, more time interacting with patients, that's going to be a plus for everybody. So I think there's a lot of potential there in AI. And on the business administrative side, I think whether it's how patients navigate, how they gain access, how we maintain network integrity and referral management, and streamline access is important. How we relieve the burden on patients on the administrative side of healthcare, where it relates to billing and pre-authorizations. There's so much potential. And I think that's where we need to focus, but focus responsibly.
So one of the priorities that you mentioned, keeping Northwell, or something along those lines, and talking about culture.
Yeah,
Um, what? How do you define healthy culture? So
right.
first of all, and you mentioned burnout, and those issues keep
Yep,
coming up year after year. Um, and what are the things that you're going to be looking for, and the things that you can impact as CEO on culture?
right. So I think when I think about culture, I still believe is is first and foremost our highest priority. Like, how do we maintain the right culture within the organization? For a lot of the obvious reasons that drives better recruitment, retention, better outcomes, better satisfaction, better patient care. Um, and I'll go back to something I learned in the ED. You know, when it comes down to it, if a lesson I learned early on that has stuck with me in every leadership role I've had since is, as a leader in healthcare, if you stay focused on doing what's right for the patient and equally focused on what's doing right for the people taking care of the patients, you're going to make the right decisions and you're going to drive the right change and drive the right innovation. And I think the special thing about Northwell is we've been very upfront about our purpose, the reason we're here. We constantly are reminding people of the value of their work. Um, and we're really focused on mission. And it's not just in words. If you look at what we do, um, we're the second largest provider in New York State of behavioral health services. Behavioral health is a negative driver to the bottom line. Yet we continue to double down on that as part of our reason for being, one of the things that we need to deliver because it's a real need right now in the community. We've been a leader in substance use disorder. We're a leader in addressing the impact of gun violence. That resonates with our staff. It speaks to our purpose. We reinvest back into the organization continually. Some of our biggest capital projects are building new behavioral health towers in our children's hospital to address pediatric and adolescent behavioral health. These are just examples, and it's not lost on our frontline staff. So I think culture, commitment, and leading with purpose is really important. I think as a physician CEO, it's important that I continue to relay that purpose, keep people connected to that, because what people are doing every day in healthcare is hard, right? It's a hard business. And it's hard for our frontline staff that's doing this 168 hours a week, 365 days a year. And you can see how, with the demands of a long shift, people's empathy may go down a bit, or, people, and we have to constantly help people rebuild, that meaning in what they do, because there's much easier jobs out there for people to do. The other thing about the culture that I love to really focus on as a CEO is um, my own personal journey. I started to reshift my attention to my own health and well-being about 8 years ago, and it really changed my life. I lost like 65 pounds. I came off of the medication I was on. And what I gave up every time I had a new leadership role was I put on 20 pounds. I started to, and I really learned with the leadership opportunities I had over time that I didn't need to do that. And I'm a father of 6. I just spent this weekend traveling for lacrosse games. And I intend to still do that as a CEO. I intend that our employees know that it's equally important to dedicate time to yourself, your family, and be your best person at home and your best person for yourself so you can be your best person at work. And I really, again, getting back to what I said earlier, how do we drive better health and wellness, not just disease management? But it starts with ourselves and our employees, and that'll continue to be a big important part of our culture of investing in our team members.
Well, I love the role model example because you're the ultimate role model, right?
Right,
And if you're doing those things and you're valuing those things, everything flows from that. Culture is it's a fascinating topic to me. I mean, I've got 30 people in my company and I think about culture. You've got
right,
100,000. And I have a hard time here
right,
at Darwin, like trying to influence culture in the best way that I know how to is exactly what you said. It's by example and the kinds of things and reinforcing those things, of course, over time.
right.
Before we finish up, I wanted to touch on one final point, and that is policy.
Sure.
So lots of policy changes over the last decade, the emergence of these value-based care models and a
Right.
lot of the CMS Innovation Center things going on there. Now we have a new administration going in certain different directions. But I'm just thinking of it from your seat and, of course, in New York, what are the biggest policy issues that are on your radar or that you're concerned that could have a financial impact on your
Right.
organization, could have a major impact on patients? So that policy lens, what are you thinking about?
Yeah. So from the policy lens of things we're focused on, um, you know, we're paying very close attention to the impact on the Medicaid population So both, yes, there's a financial component to any changes in that space, but we're also focused on, are people going to delay care? People going to fall off, go into a employed or no insurance, and wind up, leveraging the emergency department for things that otherwise they would have had access to other avenues, or are they just going to delay care overall, getting back to leading to again more complicated management of disease later on because they've been avoiding the care they need all along. So I worry really about the patients not having access to or seeking care they need, and ultimately that having negative consequences long term. So we're going to stay very committed to, again, delivering care to everyone, regardless of ability to pay, being very engaged with our community, especially our vulnerable populations, our vulnerable communities. We focus very much in partnership with community-based organizations, faith-based organizations. We've been embedding services in big congregations and social workers and all trying to get out there. And through these partnerships, we're going to continue to do that. I worry about, again, that care delivery impact or that access to care impact of policy. And as far as the other policies that is front of mind and being talked about a lot lately, I'm focused, and I want our doctors and our clinical delivery kind of experts to be focused on, again, going back to those rules. What is best for our patients, and what does the evidence in medicine tell us is best for our patients? And that's how we're going to practice medicine. And that's going to be our focus.
Well, we probably could spend a half hour just talking about policy, but I know your time is valuable, and we need to wrap things up. So, in pursuit of wrapping things up, I've got a lightning round.
Sure, let's do the lightning round.
So, just quick responses, simple word or phrase. You ready?
Okay. Yep. Let's go.
Most influential mentor.
Currently, I would say Michael Dowling, my current CEO. Been watching him for 25 years, and he's a force.
I would agree with that. A book every healthcare leader should read.
I'm rereading Outlive and I think that's a great book to think about how we focus more on the next evolution of medicine.
Most overused buzzword in healthcare today.
Most overused buzzword. I'm going to have to think about that one.
I'll give you mine, AI.
AI. Well,
right?
Okay.
Coffee, tea, or something else?
Coffee in the morning, water the rest of the day. Staying focused on my well-being.
And then finally, one bold prediction about healthcare in 2035.
I think healthcare in 2035 is going to have figured out and been more proactive in thinking differently about how we deliver care, so that we're meeting people more in the community, we're meeting them where they're at, we're keeping people healthier longer, and we're focusing more on the buzzword that's being overused, health span, rather than just lifespan, and we're helping people live longer, healthier lives with less need for inpatient and more intensive intervention.
Excellent. Well, Dr. D'Angelo, thank you so much for joining me today on Healthcare Rounds. It's been a real pleasure to hear your vision, your perspective. I hope it's not the last time that we talk.
I'm happy to talk again.
And thanks to the listeners for tuning in. If you enjoyed today's conversation, don't forget to subscribe and share the show with colleagues. And we'll see you next round.